probably have hepatitis. You have 2 hepatitis, so go to Lyme's disease. You have 2 hepatitis in that pack, don't ask why. Now, your Lyme's disease patient is a big deal because we have an epidemic in America. We literally have an epidemic in America. And our epidemic is in this state and all of the Great Lakes states around us. So you need to make sure you know. Some people still writing on hepatitis. Come on, y'all. Chop, chop. Lyme's disease. Okay, baby. Now, so here's what you put. This is an epidemic in the Great Lakes states. Pennsylvania, Ohio, Michigan, New York, blah, blah, blah. And it's because of the tick that lives on the deer. So this is a tick bite, and it lives on a deer, Bambi. Now, I said that before, and my girl from Thailand was like, who's Bambi? I said, oops, my crazy butt. Okay, so the tick lives on the deer. Now, it's the size of a sesame seed, which ain't big. It's the size of a sesame seed. For those of you challenged, go back to Mickey D's. Sesame seed bun. 2 all beef patty, special sauce, lettuce, cheese, pickles, onions on the sesame seed bun. Okay, 2 of y'all is old enough to know that. Now, when you go on the left-hand side, put early. What did we say about flu-like symptoms? Sounded like that word prodromal, didn't it? Early symptoms, flu-like. Highlight headache and put number 1. Down by muscle aches, put this fancy $4 word, arthralgia. Fancy $4 word, arthralgia. If we catch it at this stage, we just need some antibiotics for about 3 or 4 weeks. This is, again, early. The patient on the other side, it says hearing loss. This is advanced. Paralysis of the face, advanced. What was paralysis on the face in your life? It was called Bell's palsy. So hearing loss, one of the #1 causes of hearing loss in someone who wasn't born with it and is under 50 is Lyme's disease. You see it says heart complications. You don't care about that as much as you do when you go down to hot, swollen, painful joints. You need to remember in this area, put arthritis and neuropathies. Arthritis and neuropathies. This is basically a late stage 3. This is a very, very, very scary stage. If you're at the point where you're feeling neuropathies and arthritic pain, this is basically like stage 3. At the bottom, you'll see the hallmark. The hallmark is that bullseye rash. I want you to highlight the fact that it itches. It is huge. I have a picture of it on my board that I can see from here. It's so big. It's 5 centimeters or more, which is the size of my fist. It's huge. You can't miss this. It itches. It just is classic. Okay, so it's how we diagnose 99% of people. Now, at the bottom of the page, put vector-borne precautions. Prevention equals vector-borne precautions. That was a list of things you had to know to have your patient prevent getting this. And the list is so easy, it's common sense, so let's make sure we know it. Part of the list, my favorite part of the list, stay the hell out the woods. Why are you in the woods? The hell are you doing in the woods? I don't understand why your ass in the woods. Okay, I don't get that. It's not that idea of us, not my idea of a good time to be in the woods. Now, especially stay the hell out the woods between May and November. Why is you in the woods in September? Raise your hand if you've been greeted by deer every day this month. Stay your ass out the woods. Stay out the backyard. No, man, I'll tell you what's scarier than anything, and you evening shift people better be careful. When you leave here in the evening, or you go on your break at 6:30, this is the evening shift, there's 10, 15 deer out there. They're just chilling. Like, what's your problem? Why are you looking at me like me? I'm looking at you. Okay, so, you know, it's crazy. And we've domesticated them. I got a neighbor that feeds them, and I just want to slit his throat because it's crazy. Y'all pray for me. Now, so stay the hell out the woods, okay? That's number one. Here goes number two. If you stupid enough to go in the woods, tuck your pants in your socks and put some boots on and not them short, cute Uggs. That ain't gonna get it, honey. Better find you some thigh highs. In other words, fool, some serious boots need to be on you. Find you some hunters and get out there, because you doing you in the woods. Okay, so tuck your pants in your sock, put the high boots on, cover yourself with long sleeves, wear a hat, not the sexy crap y'all be trying to get cute in. I'm talking about a serious hat up in this place. Wear pastel colors so you can see this fool on top of you. And when you see it, and you will because you're in the woods, you're going to take tweezers and grab by the head of this fool and pull it off of you. If you grab the body, it's going to go deeper into you. And I got students that will tell you that's exactly what happened to them. Oh, you got people treated for Lymes now. Don't get it twisted. You have to take the tweezers and grab it by the head, or it will bury its little self right inside of you. It's really bad, y'all. You can see it. I can see a sesame seed on that damn bun. Who was stupid enough to go to the woods? Confess and shame the devil. Okay, good. Now, who's seen this thing? Because I have. Really? Look at how many. Look, guys. What happened, baby?
Well, my husband, so, like, this is the time that he's, like, actually the time.
Yeah.
You know, that's, like,
Peak.
open season. So, like, that's when they're out, you know, so a lot of times they'll come back.
They'll bring that shit back to your house.
Well, I mean, like,
What do? Strip them in the backyard.
yeah, usually they try before they
That's exciting. Okay. All right. And isn't it true that you cannot,
you can't, yeah.
they just bury themselves? Who else has seen it? Yes, dear.
My dog, actually, when we lived in Atlanta, we like let him outside just for a little bit, and he came back and he had like 4 on him, and then like the following week he had like 2 or 3 more.
Oh,
So there I was with tweezers.
trying to get at the head. You
Yeah.
got to get it off.
And
Ooh.
he's cream, so luckily
You could see it because it's
very
black.
easy.
Mm-hmm.
But yeah.
What'd you see, hon? Oh, you from the country for real. Oh, they were Clinton and them from.
But it was on the hair on my leg.
So it hadn't bit you yet, but you saw it. Did you freak out? Oh, yeah, that's true. That's what people say. It looks like a scab or a mole, but it's really a tick. See how she said that? My ex-husband. You know it's a bad story when they start off talking about their ex. What happened, baby? Tell me what he did.
I live in by Shronsville in Brunswick, and we took him to the metro parks, and it was springtime.
Oh.
And my daughter, who was 9 at the time, called me freaking out. And my 7-year-old daughter, and then my son was 6. Like my 7-year-old, she has really curly, thick hair. They were in her ears. And
They? Did she say plural?
they must have like hit a nest or something. And so their dad said, relax. He called me and said, don't panic, you know. I checked them.
They always say that.
Don't worry about it. So my oldest is freaking out. So I went over to the house. So I'm comforting her, and I'm like brushing her hair back with my hand, and it has like this really smooth texture to it. And I started like going through her.
No more, I can't handle it. I'm good right there. Oh, God.
But he thought, like, he checked them. My son is blonde. And he was like, he doesn't have any, because his hair's blonde and they're black. No, he had them too. It was bad. So
they got treated.
He picked it, like he picked all of them out, like squeezed them at the head with his hands and like would throw them in the toilet. And I called a pediatrician and I just watched them because it was like within like an hour and a half.
Oh, okay.
So she said that, because I was like, do I need to, like, can I do something in advance to, like, prevent something from happening?
Because she was going to see him in the morning. I would have treated them. Did she treat them in the morning?
I didn't. I watched them. I kept an eye on them.
Maybe because it was within an hour.
Yeah, maybe.
I'm crazy. I've been like, you better call me some damn doxycycline in. Okay, doxycycline is the treatment. Yes, baby.
I was going to say, my boyfriend and I went backpacking earlier this year.
You and your man went in the woods, didn't you? Uh-huh. See, this is when true confessions come out. Tell me about what you and your man did in the woods.
I was neurotic with that, like, every day, though.
Oh, you were? You couldn't even relax, could you?
3 on him when I was crawling up his leg.
He did. Are you now going to stay your ass out the woods? You got all these damn testimonies. Okay, honestly, look at the picture and remember you're grabbing it by the head. Okay? Now you need to write doxycycline, penicillin. All of those things will treat it. Doxycycline or penicillin. Who can't have doxycycline? Pregnant women. And what's your instructions when you're giving doxy? No milk. See, the veterans will tell you what's going on and getting all this shit right. Okay, turn the page. Now I got a news flash for you. You don't care about that page. Turn it again. Only thing you care about this page, Rocky Mountain spotted fever, is that it's a tick bite. Now you care about this one. Infectious mononucleosis. A whole bunch of you have had this, and a whole bunch of you will tell it's bad. You have some classic hallmarks. Some classic hallmarks include severe sore throat, and it's so sore you think you have strep. You don't have strep, but you're ready to fight somebody who told you you didn't. You get a throat culture, you don't believe it. You turn around and get another one because you don't believe it. And that's because this can last for 3 months. You are exhausted. You can't get out of bed. You can't swallow, eat, drink. Your throat hurts so bad you can't get out of bed. My cousin, I don't know if you were this lucky if you had it, but she swears by a case of mono is better than Weight Watchers. She lost so much weight, went from a size 24 to a size 5'6", and she's never divvied from that size. And she did have to miss a semester of college because you're so exhausted. And so you have missed a lot of school. It's called the kissing disease because it's transmitted through saliva. However, put at the top of the page what you guys keep missing, and that is its standard precautions, not droplet. Because unless you go in there and kiss your patient, you probably cool. I mean, the stranger things have happened, y'all know. So it's a kissing disease, standard precautions, boom, okay? Now, let me tell you something. Mono ain't nothing to play with. You are so sick. You have a temperature. If you walk the page, it tells you everything. Under transmission, It talks about it being, you know, college kids and high schoolers, anywhere from 15 to 24, but little kids can get it too. It's called the kissing disease. You see the saliva, so you're just highlighting. You see you're exhausted, fatigued, decreased energy. You could put any word you want there, lethargic, malaise, whatever. You see it says sore throat, and you see I said it's severe. The fever, you could put chills with that and be correct. Fever of 101 to 104 is pretty serious. Enlarged tonsils, they're red. I want you to put this fancy $4 word. Remember, this patient is going to have lymphadenopathy. And that just means swollen lymph nodes. Lymphadenopathy or swollen lymph nodes. We did this in toe-to-toe the other day, and several people missed that it was standard precautions, and several people missed the fact that you do a blood test to diagnose it. At the bottom, it's called a monospot. Please don't go in this test talking about throat culture, because that ain't what you do. You got to do a blood test. And then look on the other side. It says Epstein-Barr virus. Yes, you want to make sure you highlight that. You want to add on your list above skin rash, body aches. Underneath skin rash, weight loss, extreme weight loss. Who lost some sizes and happy for it? Anybody? Anybody lose a lot? Anybody lose too much weight and look terrible?
My son did. He was already skinny.
Oh.
He was already skinny. He had it.
How old was he?
He was like 16, but I whooped his ass. Stay away from nasty girls.
Oh no! She thought it was STD. She told him to stay away from them nasty trifling girls. Pray for her, y'all. It could have been like somebody let them have a drink of their water. It's saliva. Okay. All right. Now, so stay away from them nasty ass girls. Okay. Now, the pain in the left upper quadrant, splenomegaly. Did you have that pain? Oh. And it's abdominal. See, the patient doesn't know. They're going to tell you their stomach hurts. How old were you?
Gosh, I was in high school.
And you remember that
I
pain?
was my sophomore year of high school because I had to take all my final exams over summer.
You miss a lot of
I
school.
missed a lot, yeah.
You can't get out the bed, you guys. It's really profound. Anybody else miss a lot of school? Nursing school? Hope not. Okay. Now, loss of appetite. This person couldn't care less about eating. And make sure you know that typically these symptoms last 12 weeks. That's a long time. At the bottom, what would you call that list? Think it through. That whole list, what would you call it? Basic care and comfort. Now write it. Basic care and comfort. How do you make your patient feel better? Now you need to highlight where it says course is self-limiting. Because one thing that's going to make your patient mad is when you tell them there's really nothing you can do about it. Then they're going to try to bomb the clinic. Now underneath that, I want you to put FMLA. Why FMLA? Because you're going to miss a lot of work in school. Let's make sure we're clear on FMLA. How long do you have to work for a place to be eligible? 1 year. How many employees do they have to have? 50. Now, what qualifies a person for it? Any family member that they're responsible for, so it could be your parents or it could be your children, who has something where it's chronic and you're going to be going back and forth. Lots of you as nurses really need to know when you qualify. If you have a child with asthma, newsflash, you qualify. If you have a child with sickle cell, you qualify. If you have a mom with cancer, God bless Holly's soul. Holly sits here and her mom died. But her mother had cancer and she was going for this alternative treatment way over in Pennsylvania, the wonderful cancer centers over there. And so I told Holly, girl, please be with your mom. You can get this NCLEX anytime. Go be with your mom. And she's a nurse now, but reality is that would have been an FMLA type of thing. Now, the only thing you have to remember is there's no government protection until you've worked there 1 year, unless they have 50 employees and you've submitted the proper paperwork. Because I had to tell my sister-in-law who works for the school district, What the hell are you doing? I got FMLA. Did you do the paperwork? No, I ain't got to do. Yes, you do have to do the paperwork. Everybody don't qualify for that crap because the paperwork's got to be certified by me, a doctor or a provider. You don't just, oh, I got FMLA. No, fool, you don't. You have to wait for HR to say, yes, you're approved. We had someone that got in major trouble with her job because they had not approved it yet, and she took off again. Now, it's true, if you got to take off, you got to take off, but then don't get mad at the job thinking I had FMLA, not until they approve it. And how do you get it approved? Well, you have to certify it with one of us, a provider. Okay? All right, the next page is easy. Really easy. You have to be careful when you go and you study. Obviously, HIV and AIDS is a complete and total lecture. Many of you have had it already. But this page is important and included in this packet as an infectious disease precaution because of the title being so critical to your understanding. What does it say as a title?
Don't.
How you don't catch it. Highlight don't. Now, I put in the middle of the circle all the ways you don't catch it. So I'm going to give them to you. I want you just to go down the middle of the circle like I did. Go ahead and put that down there. Here we go, y'all. Put tears. Put tears. Put saliva. Put urine. Stool. Hugs. Kisses. This is how you don't catch it. Now, what are the number 1 and 2 ways? Put it real big across the bottom. Semen and blood. It's a freaking STD. At the top of the page, put standard precautions. Quit dressing up like a mummy to get this patient care. When you know Tyrone is a whore and you won't put a condom on with him. He slept with half the neighborhood. You're still with him, let me remind you. Plenty of people I'm talking to. But you want to dress up and look retarded when you go in this room. Because you want some stupid stuff. Okay? So semen and blood. The highest risk behavior you can engage in is anal sex. So you and Tyrone, let me know how that worked out for you. Now the next page, you don't have to write anything because obviously we do it in class. The next page is the next lecture you're going to be having, which is respiratory, and it's huge. We do it in class. And then the next page, if you were to keep turning past HIV, you should get to something that says hepatitis. And you have another hepatitis, so you have 2 hepatitis handouts. The first one you're very familiar with because you did it in your GI lecture. And the second one is just kind of emphasizing if it's from the bowel. If it has a bowel, it's from the bowel. Now, the very first page with the hepatitis that you're familiar with from your GI lecture, I'm going to use this page for you to put across the top reportable STDs. So across the top of that page, just put reportable STDs. Now, almost all of them, but here they are. Gonorrhea, chlamydia, syphilis, HB as in boy, V as in Victor, which is abbreviation for hepatitis B virus, HBV, HCV, hepatitis C virus, and HIV, human immunodeficiency virus, right, HIV. Now the last one you're not familiar with for reportable STDs, And we see it more so with sex trafficking and prostitution. It's called cancroid, and we see it abroad. So if someone has traveled abroad, especially our military guys, they may bring this home to you, darling. Watch your man, honey. Okay. So cancroid is considered to be open ulcers that are extremely painful in the genital area. So open ulcers that are extremely painful in the genital area. It's associated with recent travel. These ulcers bleed very easily. And they cause very swollen lymph nodes and can cause an abscess. Now, if you turn to the next page, I'm going to use this page for all our diarrhea. Now, at the top of the page, all diarrhea goes in a private room. Write it so you remind yourself. All diarrhea, private room. Contact precautions. Enteric precautions. All diarrhea, private room, contact precautions, enteric precautions. Okay, let's do them. Let's put Giardiasis first. Giardiasis. And I used to be able to say this and you understood what I meant, but that's how long I've been doing it. And now I'm not sure you will know what I meant. So I used to say for Giardiasis, Giaga Lake, but they closed it. Giaga Lake was an amusement park that had a water park in it. This is water parks. So the different water parks that you see sprouting up all over the place, not your big commercial ones like Kalahari and all this. No, no, no. Your little rinky-dinky ones. This, you know, the carnival went up in 15 minutes over on the corner. They got a water park, girl. Ain't you gonna bring your kids? Hell no. So Giardiasis is literally water parks. Yep. And then the treatment is even easier. 6 Flags. Flagell. So we treat Giardiasis or Giaga Lake with 6 Flags. Flagell. What's the generic term? Metronidazole. Very nice. You have to know that. What do we teach when we give somebody Flagell? No alcohol, said the nurses. Y'all better know that. Okay. So this is a waterborne disease. Usually we believe it comes from the diapers and all this in the water. These crazy parents with their, kids shitting all in the water. Okay, next one. These are easy. Shigella. So, God bless you. So sprinkle your diarrhea all over the page. Shigella is the next one. Now I have a trick for this one too. Shigella, shitty diapers. God bless you. Shigella, shitty diapers. This is daycares. Shigella, shitty diapers. This is your daycares. I'll give you an example of crazy. One of my daughters went to go help a friend of mine out that owns a chain of daycares. The friend of mine was on a cruise, gone for a 14-day cruise, and whether or not she properly managed to put someone in charge that had some sense or not, I don't know. But my daughter went to go help out the little daycare while she was gone, and these fools ran out of gloves and said, that's all right, just reuse them. So 2 people changed all them babies with that pair of gloves they had on. Now you got to remember, when we take kids to daycare, are these PhD providers? No. What education level? You say drop off? High school, whatever, right? They're not really going to be like college prepared and all this. They're just trying to get through the day. Just think, fast food worker taking care of your baby, okay? So you have to remember, no, seriously, I mean, it's the same requirement, okay? So you have to remember that some of this is just really no hand washing. This case, using the same pair of gloves to change all the babies, crazy. So if one of these kids had Shigella, now all of them do. You know, there's a very high chance. Now, Shigella, shitty diapers, here we go again, Cipro. That's what we used to treat it. Shigella, shitty diapers, Cipro. That's how you're going to remember this one. You got to have tricks up in this piece. Sewage. Poor sewage. So Shigella, shitty diapers, sewage, Cipro. Just keep your S's and C's together, okay? Now, this one is bloody. It's very sad. It's bloody diarrhea. It takes months to recover from Shigella. So Shigella, shitty diapers, Cipro, sewage, raw sewage, shitty diapers, whatever. Okay, so it takes months. The complication is arthritis. And I've had 2 of you that had kids with this in daycare. Big Mama's still the best one to watch your child. Big Mama working at Walmart and McDonald's and shit. What's going on? She's supposed to be at home watching babies. So the next one is cholera. Let's put that, it's over there too, but I'll put it over here. The next one is cholera. Where was there a cholera outbreak from an earthquake? Where? Haiti. Yep. And what happened is when missionaries and beautiful people like yourselves went to go help out Haiti with their earthquake, which was tragic. At the border states, some people brought back cholera. Now, the good news is cholera does not kill us, but it kills within 18 hours people that don't have the facilities like we do at the hospitals. We have a hospital on every corner. So this condition kills within 18 hours. That's how sick you are. And it's rice-like diarrhea. Rice-like diarrhea. So it's in areas with poor sewage, areas with earthquakes or hurricanes. Definitely hurricanes. Really have to be careful when there's a hurricane. Can kill you within 18 hours. So far you got Giardiasis, Shigella, cholera, and these are just diarrheas. Next one, Salmonella. Salmonella is very much associated with chicken, raw eggs, raw meat, and here's 2 that you might not have known. Frogs and turtles. So let me tell y'all, if you got kids, do not do this, okay? Don't do this. You might be tempted on any exam when you're dealing with the possibility of salmonella to throw the turtle to the curb. I'm a mom, I get it. You ain't in the mood for no turtles and frogs, I get it. But you can't do that. That's their best friend. So what you want to do instead is you have to teach little Johnny frequent hand washing. Quit trying to throw the frog in the toilet and act like he swam away or some bull crap. You teach him frequent hand washing. Okay, this is for any time it shows up somewhere in your travels, this salmonella. Now, obviously it's about eggs and raw egg products. Remember everyone, raw egg products include mayonnaise, salad dressing, macaroni salad, potato salad, all this kind of stuff. anything with salad dressings and stuff in it. Now, I'm not going to lie because I try to be transparent so that you know your teacher is full of crap and crazy. At our house, we are bad. I ain't gonna lie now, we bad. We don't even cook it. We just eat the cake batter, we eat the cookie dough, we do all kind of stupid shit at our house. And we pride ourselves on making an event out of it. You got the movies, I got the cake batter. I mean, just ghetto, just crazy. But we're taking a risk, aren't we? Because raw cookie dough and cake batter have egg in it. So it's kind of stupid on our part, but we gotten done with it. You know what they say, God take care of fools and newborns. Now, wash the fruit. That was also something you had to know. That's why we scrub and wash our fruit. So we wash and scrub our apples before we eat our cake batter. That's how we do it. I do that, but then I got the kids eating cake batter. What is that about? Oh, Lord. Now, Salmonella is also treatable with Cipro. In fact, it's probably a good idea, everyone, to remember in the times when we need an antibiotic, Cipro and Flagyl are usually the two for diarrhea. So one or the other is a good guess. Either Cipro or Flagyl is always a good guess for diarrhea. Now, all of these diarrheas need one thing more than even that antibiotic, and that's called oral rehydration. Oral rehydration is the #1 nursing action. Never let me hear you went in there and gave the patient an anti-diarrheal. No Imodium, never that. Do not give anti-diarrheal. You know, the ones you bought when you had diarrhea, don't do that. You're not giving Imodium, you're not giving no kaopectate, you're not finna get no Pepto-Bismol. Stop it. Why do we not do that? Because whatever is in needs to come out, because all diarrhea is infectious. So don't take anything for it. That's crazy. The only time ammonium and those things are appropriate is when the diarrhea is from radiation or chemo or inflammatory bowel disease. But infectious diarrhea, hell no. VRE, no. Okay, so no antidiarrheals. So oral rehydration, no antidiarrheals. And then Cipro or Flagyl is usually the drug of choice. And then don't forget this. Probiotics. Okay, turn the page. Now, many of you have come to toe-to-toe, and you know we covered these meds thoroughly in the last toe-to-toe we had. You better know these meds, I bet you that. At the top of the paper, put treatment for TB. At the top of this paper right here, put treatment for TB. Find your top of your paper. Some of y'all ain't nowhere near it. Come on, stay with me because I'm rolling. Y'all about to go on break and you're going to miss it. The first 4 meds are the treatment for TB. The last medication is an alternative. The first 4 meds are the treatment for active TB. They include isoniazid, which you know is INH, rifampin, pyrazinamide, and ethambutol. These are the 4 drugs we need to treat active TB. Pyrazinamide is called PZA. We only take that for 2 months. Everything else is 6 to 9 months. And yes, you better know it. We're going to be going over it, so I don't spend a lot of time on that.